Hello, it's Dr. Lorenz, Longevity Health Institute. I hope you're well. Hey, listen, I can't not tell you this and share this because I see the problem all the time, and that is the benefits, and there are positive ones, but also the excess and damage you have to be careful with using creatine. So, what is creatine? So creatine is a synthesized compound from amino acids, glycine, arginine, and methionine. And our liver makes it, our pancreas can make it, kidneys, and then it's stored in your body. It's often stored in muscle. So there's tons of use out there of creatine with the youth, getting big and lifting and whatever, especially the young guys in their teens and 20s. But I also across patients, even women, happen today, in their 60s that will actually be using this because of, yes, some benefits, and we'll go over those, but where you have to be careful because of the side effects and long-term high-dose use and what it can do. But let's get to the good. So, this is a donor to synthesizing ATP. So creatine is a donor into making ATP. All that's great because ATP is energy. And if you know me or you watched a bit, I like energy and I'm full of it. So the energy is a great thing, right? And there's studies on this actually with ALS benefits. There's studies on mental cognition and mental clarity, mood improvement, energy improvement, muscle recovery, muscle actually even growth, okay? So it's often used in people that are trying to sports perform or work on recovery. And absolutely, hands down, there's no question, that's all well documented, okay? So the use of creatine and its benefits are well documented. I do believe, though, you have to think of this physiologically, and I see this clinically, and this is where I want to hammer this home, is that you have to be careful. You have to talk to your doctor. You have to get blood tests specifically on your kidney, specifically your GFR, so your kidney filtration rate, okay? Because yes, it can repair, and yes, you can heal from stress on the kidney, because the kidney is, to some degree, recoverable. But you're flooding something that is a high amino acid compound, so essentially something that's hard to filter through a small glomerular filter, and especially if you are any form of dehydration and not enough hydration, you will stress your kidney. I have seen people's GFRs, which you want a high GFR as good health, in the 90s and 100s. I've seen them drop down to 40s, which is considered chronic kidney disease, stage 3, okay? And yes, that's probably repairable and reversible because we get them off of it, we hydrate them well, we talk about actually having more plant-based, less proteins for a while, get them really hydrated really well, and it usually resolves. But it doesn't always resolve in somebody that's used creatine at high doses long-term for months or years, okay? Now, what do I recommend? Well, if my patient feels like they need it for muscle recovery, muscle regeneration, energy, if you will, I only recommend using 1 to 2 grams. If you're a really big guy, maybe 2 to 3 grams. Understand, you can go onto some websites and some bodybuilder sites and some muscle performance sites talking about 10 and 20 and 30 gram loading doses. This is 20, 30,000 milligrams of creatine. Your kidney cannot handle that. It can barely handle 5 grams, 5,000 milligrams a day, because I saw in a lady today in her early 60s that actually, very healthy, by the way, very healthy kidney. But remember, the kidney physiologically and functionally is yay big, okay? So when we talk about structure in our 6-point model here at Longevity Health Institute, you have to consider the size of the kidney and the ability of the kidney to filter, plus everything else you're putting in your body for your kidney to filter, including the proteins and amino acids that are in your diet. So just be cognizant of this. Again, I'm not against creatine, but this is so important. I see this error made so many times, and I have had people come in with their kidney function really damaged because of years of creatine use, and then we have to get into recovery of how we reverse that, which we do with hydration, getting off of creatine, with some supplements, including phosphatidylcholine, even IV, that we can reverse this, okay? But do no harm first and make sure you're talking to your physician. Hopefully it's a functional, personalized medical physician and provider, so they're looking at this. And again, I want to state, I'm not against it. Just don't think that these loading doses are the healthiest for you. And if you're trying to feed your ATP, there's many other ways to do this, and at least pump the brakes and look at your dosing. Again, maybe 1 to 2 grams per day, get your blood tested and get it retested, okay, and that can bring you the benefits. The other thing is this, you will feel muscle improvement because somewhat is it hydrates and fills the muscle with fluid, with water. So of course you're going to feel bigger. You're going to feel like you're making muscle gains. It's not always muscle gains. It could just be volume. So be also aware of that. There's many ways, and you know I'm all about helping and maintain mass. And I personally, I don't care regardless of age, what my patient is, male or female, or age, they lift weights, okay? You have to maintain mass to maintain health. Every study shows that, just like you have to maintain and improve VO2 max. Every study shows that you will live longer with less chronic disease, with less conditions, and you will thrive, not just survive. Remember that, but it doesn't have to be with creatine or excessive use of creatine. This is Dr. Lorenz. Hopefully this educates you a bit. Be well. Always here helping you with the best and personalized functional medicine.